If you're listening, chances are you know that special connection with your cat. But sometimes there's stuff going on beneath the surface health-wise that we just don't see until it's, well, pretty serious. Today we're diving into feline chronic kidney disease. You might hear it called CKD. And this deep dive, it's really tailored for you, pulling the key info from the sources you shared with us. Okay, so the big thing to get right away is that CKD is really common and really serious, especially for our older cats. It progresses over time, and sadly, you can't reverse it. It's actually considered the #1 cause of death in domestic cats. Heartbreaking, really.
It really is. And the severity, it's significant. What makes it so tricky, so insidious, is how quietly it moves. Often, by the time you actually see clear symptoms, a lot of the kidney function, maybe most of it, has already be gone. Think of the kidneys as this super important filter system for the cat's whole body, working away silently.
That's quite sobering how much is happening unseen. Okay, let's unpack this filter system idea. What are healthy kidneys actually doing for a cat? Day in, day out. What's their job supposed to be?
Right. Their role is huge and absolutely vital. So first off, they're constantly filtering waste products, things like urea, creatinine. These are toxins that build up in the blood. Healthy kidneys pull those out. If they don't, the cat can feel really sick, nauseous, tired. It's like being poisoned from the inside.
Okay, filtering waste. Got it.
Second, they're masters at balancing things, specifically water and important salts, electrolytes like sodium and potassium, keeping the hydration right, making sure everything else functions properly. That balance is key.
Makes sense.
Third, they concentrate urine. This is a big one for cats. They pull out as much water as possible before waste leaves the body. Helps prevent dehydration, which is crucial since cats don't always drink a ton of water naturally.
Right, that evolutionary desert thing.
Exactly. Fourth, they help control blood pressure, keeping it stable. Good blood pressure protects other organs too. And fifth, they actually produce hormones, specifically ones needed to make red blood cells.
Wow, that's a lot.
It is. So with CKD, basically these amazing filters start to fail. Waste builds up, that water and salt balance gets thrown way off.
It really puts into perspective how critical healthy kidneys are. You mentioned balancing water. Is that why we sometimes hear about cats with kidney issues drinking loads more water, but they're still dehydrated?
Yes, precisely. It seems counterintuitive, but we'll definitely touch on that again when we talk symptoms.
Yeah.
It's a key sign.
Okay. So delving into the why, here's where it gets really interesting, I think. What causes CKD? Why is it so common, especially as cats get older?
Yeah, it's often multifaceted. But the single biggest factor is just age. For many cats, it seems to be almost a natural part of the aging process, unfortunately. The numbers are pretty stark. We're talking maybe 30% to 50% of cats over 15 years old are affected. And even for cats over 10, maybe 1 in 3 could have some stage of CKD. It's really prevalent.
1 in 3 over 10. Wow.
Beyond just age, genetics likely plays a part. Some breeds, some family lines just seem more prone. And there's this interesting theory about their wild ancestors. Cats evolved in dry places, right? So they developed these super efficient kidneys to conserve every drop of water. The theory goes that maybe these highly tuned kidneys in our modern domestic cats who have plenty of water might sort of overwork themselves or just have a shorter functional lifespan. They wear out faster.
Huh. That's fascinating. Like they're too good at their job almost.
Kind of, yeah. Then you have things like infections, kidney infections themselves or kidney stones. Even really bad bladder infections, if they're not treated properly, can damage the kidneys over time.
Okay. Infections. What else?
Poisons and toxins are another big one. If a cat accidentally eats something harmful, certain human medications, antifreeze is a classic, sadly. Even common household cleaners like bleach or toxic plants. Lilies are extremely dangerous for cats. Grapes too. Ingesting these can cause severe acute kidney damage, which sometimes then becomes chronic.
Right. Need to be careful what's left lying around.
Definitely. And then there's something maybe less obvious. Water intake. Cats evolved to get most of their moisture from their food from prey. So if a cat eats only dry food, kibble, and doesn't drink enough extra water to compensate,
Yeah?
that can put long-term stress on the kidneys.
Ah, the wet food versus dry food debate touches on this then.
It certainly can, yes. It's about overall hydration. Finally, other health problems can lead to CKD. Diabetes is a really common one that can damage kidneys. High blood pressure is another, and it can be a vicious cycle. CKD causes high blood pressure, which then damages the kidneys further. Heart problems too. And sometimes a cat might have a sudden severe kidney injury that's acute kidney failure. And if they survive but the damage is bad, it can transition into chronic disease.
That's a whole range of potential causes. And you said earlier the really tricky part is catching it early. Symptoms often don't show up until, what, 75% of kidney function is already gone? That's quite late.
It is, yeah, very late in the process.
So what does this all mean for us, for you listening? What are those signs, maybe subtle at first, that we really need to be watching for?
This is so important because the signs can be subtle. The first one, and maybe the most common early sign, is drinking more and peeing more. You might notice your cat hanging around the water bowl more, or the litter box needing cleaning more often. The urine itself will likely be very dilute, almost watery.
And you said people misinterpret that sometimes.
Yes, very often. Owners think, oh good, my cat's drinking plenty of water. But really, the kidneys are failing to concentrate the urine, so the cat has to drink more just to try and flush waste and stay hydrated. That increased thirst, especially if there's no other obvious reason like hot weather, is a major red flag. Don't ignore it.
Okay, increased thirst and urination. What else?
Well, even with drinking more, they can still become dehydrated. So you might look for signs like maybe their fur looks dull or unkempt. Or if you gently pinch the skin on their back, it might not snap back quickly. Their gums might seem dry or tacky.
Subtle signs of dehydration.
Exactly. Then there's weight loss, often gradual at first, and changes in appetite. Your cat might become picky, turn their nose up at food they used to love, or just eat less overall, maybe stop eating altogether eventually.
Okay, weight and appetite changes.
As those toxins build up, because the kidneys aren't filtering properly, you can see tummy issues, vomiting, sometimes diarrhea. The body's trying to get rid of the waste somehow.
Makes sense.
You'll also likely see lethargy, just general weakness, sleeping more, playing less, not jumping up as much, just seeming off.
Less energy.
Yeah. And bad breath is another common one. Sometimes it's described as having a sort of chemical ammonia-like smell, uremic breath. Along with that, their coat quality often declines further. It might look rough, greasy, or matted because they stop grooming properly, maybe even hair loss.
Right, poor coat, bad breath.
And then in really advanced stages, you can get what's called a uremic crisis. This is an emergency.
Yeah.
Severe vomiting, really rapid weight loss, maybe seizures, needs immediate vet attention.
That sounds incredibly serious. It really drives home how vital it is to catch any earlier signs. So if we do notice some of these things, or even just for regular checkups, how do vets figure this out? How do they diagnose CKD, and what's the deal with getting tests done early?
Diagnosis involves a few key things. Your vet will definitely listen to the symptoms you've noticed, do a full physical exam, checking weight, hydration, feeling the kidneys if possible. But the real confirmation comes from lab tests. Blood tests are crucial. There's a relatively newer test called SDMA that stands for symmetric dimethylarginine. What's fascinating and really useful about SDMA is that it can often detect kidney issues much earlier. We're talking maybe when only about 40–50% of function is lost, sometimes months or even years before other markers change. Gives you a heads up.
Wow, so that SDMA test is a big deal for early detection.
It really is a significant advancement. Then you have the more traditional blood tests, BUN, which is blood urea nitrogen, and creatinine. These are those waste products we talked about. If the levels are high in the blood, it's a strong indicator the kidneys aren't filtering them out like they should.
Okay, SDMA, BUN, creatinine in the blood. What about urine?
Urine tests are just as important. A urine-specific gravity, or USG, tells us how concentrated the urine is. Remember how we said failing kidneys can't concentrate urine? This test measures that. Very dilute urine is a classic sign of CKD.
Like watery pee.
Exactly. And they'll also check for protein in the urine, often with a test called a UPC, or urine protein. Creatinine ratio. Healthy kidneys keep protein in the body. Leaky, damaged kidneys let it spill out into the urine, so too much protein is another bad sign.
Gotcha. Blood and urine tests are key. Anything else?
Sometimes imaging is helpful. An ultrasound can let the vet see the size and shape of the kidneys, look for stones, cysts, or other structural changes. X-rays can also be used. And checking blood pressure is really important too. We mentioned CKD can cause high blood pressure, which then makes the kidney damage worse. Yeah. It's a cycle you need to manage.
Right, the blood pressure connection.
So if we connect this back, regular vet visits are just so critical, especially for older cats. The recommendation now is generally annual checkups, including blood and urine tests for cats over 8 years old, and for cats over 10, maybe even every 6 months is better, because catching CKD early, before those severe symptoms start, makes a huge difference.
How so?
It gives you and your vet time to intervene, to manage the disease with diet changes, medications, Fluid therapy, perhaps? It won't cure it, but it can significantly slow the progression and maintain a good quality of life for much longer. Early detection really is power here.
It really seems like it. Understanding how the kidneys work, knowing these often subtle signs to watch for, and then being proactive with vet visits and those tests, it all seems absolutely essential, especially as our cats get into their senior years. This deep dive really highlights that responsibility we have.
It absolutely does. And maybe a final thought to leave you with, reflecting on how CKD works, how it creeps up so silently, it really underscores the true value of that routine preventative care. Not just for kidneys, but for everything. Even when your cat seems perfectly fine, those regular checkups are an investment. So I'd encourage you to think about that knowledge. Think about the proactive steps you can take now with this understanding to really safeguard your cat's health and happiness for as long as possible. It's about ensuring more good years, more purrs, more of those comfortable, sleepy stretches together.